Merci, Monsieur le Président. Your Excellencies, distinguished delegates, very honored to be part of today's panel. And let me start by saying how important it is that we continue to shine a light on the HIV epidemic, on the individuals, on the groups, and the marginalized communities that are at greatest risks, on unequal access to treatment, and on the vital importance of sustained funding. HIV is entirely treatable and preventable. We must keep this at the center of our attention. Nobody with HIV/AIDS should go without antiretroviral medicines. Nobody should lack access to HIV prevention tools. Nobody should die of AIDS-related causes. People with HIV can live long and full lives, and we can end AIDS as a public health threat by 2030 if treatment, testing, and prevention services are accessible, affordable, and available to everyone. And yet, the world is off track when it comes to ending AIDS. Although 3 out of every 4 people living with HIV are on treatment, more than 9 million people are not. Stigma and discrimination continue to prevent concrete progress and pave the way for a resurgence of infections. Together, we have the power and the responsibility to change this. When human rights are protected and promoted, health is also protected. Unfortunately, the opposite is also true. Every policy that discriminates against people in disadvantaged situations or from marginalized communities limits their access to prevention, testing, and treatment. Every crackdown on civil society makes it harder for people living with HIV to get the support they need. Every week, 4,000 adolescent girls and young women worldwide acquire HIV, 3/4 of them in sub-Saharan Africa. Gender inequalities, gender-based violence, sexual violence as a weapon of war, and trafficking all exacerbate women and men's risk of HIV. So does the denial of the right to education, including on sexual and reproductive health and rights. HIV rates are several times higher among gay men and other men who have sex with men, sex workers, people who inject drugs, transgender people, and people in prisons because of stigmatization, marginalization, and scapegoating. Around 1 in 10 new cases of HIV is caused by drug use. Laws that criminalize HIV and drug use prevent people from accessing prevention and treatment. Criminalization creates fear and costs lives. A study in sub-Saharan Africa showed that HIV prevalence among men who have sex with men was 5 times higher in countries that criminalized same-sex relationships. These discriminatory laws are outdated, and they should be relegated to our history books. Thanks to brave, tireless campaigning by civil society, more and more countries are doing just that. There is a global shift away from criminalization of LGBTIQ+ people, but we must also beware of a backlash against gender non-conforming people in many countries. To be sustainable, the HIV/AIDS response must also be embedded within broader economic and social policies that address inequality, poverty, and systemic barriers to healthcare. Globally, the international community needs to ensure universal and equitable access to HIV-related medicines and other tools, and we cannot allow them to be monopolized for private profit. We must strengthen development financing and tackle the dangerous levels of debt that are obstructing low and middle-income countries from investing in health. Cutting funding, that's what is at a very low level at this fragile moment, is tantamount to cutting off the future for so many people around the world. And we must place human rights at the very center of the HIV response, which is the only way to end this crisis once and for all. To protect everyone's health, we need to protect everyone's human rights. Thank you very much.